Carlson, State Director for AARP Ohio. I'm pleased to welcome you to today's important discussion on helping you navigate your Medicare options. AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering Americans 50 and older to choose how they live as they age. With a nationwide presence, AARP strengthens communities and advocates for what matters most to the more than 100 million Americans 50 plus and their families. That's health and financial security and personal fulfillment. We're here today to help you make sure your Medicare coverage still works for you. We know navigating your coverage can be sometimes difficult and overwhelming, and we will see to it that you're able to make informed decisions about your options. Today, we'll take you through changes of prescription drug plans Part D, Medicare Advantage plans Part C, and other crucial updates. We will be providing deadlines and tips for navigating the enrollment process, how to make changes to your coverage, and who to contact for support in your state. So make sure you're taking notes. Before we get started, I'd like to highlight some of the important work we're championing at the national level. The Connecting Caregivers to Medicare Act would help inform Medicare beneficiaries about the options to fill out a form to give Medicare permission to share their personal health information with family caregivers through 1-800-Medicare. 1-800-Medicare allows you to speak with a real person about Medicare 24 hours a day, 7 days a week. It could be a key point of contact with Medicare for Medicare beneficiaries and their family caregivers. As a caregiver myself, I know that service is vital to helping your loved ones make the most of their Medicare coverage. You can learn more about our advocacy work and access additional Medicare resources at aarp.org/Ohio. Now on to today's event. You're going to enjoy today's session as you learn more about navigating Medicare's options. Thank you.
Hello, everyone. My name is Xavier Bond. I am the Program Manager of Medicare Education at the National ARP office. Once again, thank you for coming today. ARP has fought tirelessly over the years to help all of those who are on Medicare, whether you're on Medicare due to a disability, ALS, end-stage renal disease, or you age on to Medicare. Some of the things that we have recently fought for is a historic prescription drug price reform, whether that be the insulin capping at $35 or increasing beneficiaries' access to vaccines like COVID, flu, RSV, and shingles, which are now free, or the fact that for the first time ever, the government can now negotiate for prescription drug costs to help lowers everyone's costs. And throughout this presentation today, you'll learn about more things that that are changing in 2025 that ARP helped to fight for. And so next we will have Samantha Brooks, who will be doing the presentation for today.
Hi, my name is Samantha Brooks, and I noticed, Robin, that my video is disabled. I'm not sure if you can bring that back up. Okay, there we are. So thank you for that. So I am going to be doing the video for today. I am a volunteer with AARP, and I have been volunteering for probably about 8 or 9 years now. So please let me know if okay, so now we can see the application, but I am, let's see if I brought the correct one up. Okay. So it's not letting me do the screen, the video now, or the PowerPoint now. And so Robin's going to try to help me with this so that we can bring the PowerPoint presentation to you. But while we're doing that, and hopefully we will be able to catch up. But I'm going to start to go through that because I know that we only have a little bit of time, and I do want to get through all of the slides that we have. So Xavier mentioned that with Medicare, that a couple of things have happened, and you're now seeing my babies on the screen, but a couple of things have happened with Medicare this year. From the Reduction Inflation Act that was passed in August of 2022. And in that act, there were certain things that were going to happen each year. And this year, what we're going to see in 2025 is that Medicare beneficiaries will be limited to paying $2,000 out of pocket at most. And that's a huge improvement from when the Medicare Modernization Act was passed in 2003, which contained the prescription drug plan that started in 2006. During that time, there was a donut hole, if you remember, and during that donut hole, individuals were asked to pay 100% of their medication. And then in 2010, the Affordable Care Act was passed, and we were then asked to pay 25% of the cost of our medication when we were in that gap. The Inflation Reduction Act closed that gap. And so we no longer are going to be required to pay more than $2,000 in any given year. What is also really good about this is that you are going to be able, if you'd like, to spread that $2,000 over a 12-month period. You must go through your prescription drug plan in order to set that up if you'd like. One of the other things that we're going to see is that Medicare share how much they paid when we entered the catastrophic phase of the insurance prescription drug program is going to be reduced. So much of that is going to be passed on to recipients. So I'm still not, it still looks like I'm not going to be able to share my screen right now. Robin, I think, is taking over that. So hopefully she will be able to get that started for us. Okay, so we are going to try to get that fixed. What you're going to see on the next slide was, and let me see if I can do this another way. What we're going to see on the next slide was actually a chart of how the prescription drug plan is going to look in 2025, where we will have an initial phase in which all of us will pay, or many of us will pay the standard drug deduction. And next year, that's going to be $590. Some plans will have a lower deduction, and other plans will have a higher deduction, up to, but no greater than $590. So in phase 2, that is when you will begin to pay no more than that $2,000 in cost. And that $590 will also be deducted from that $2,000. So any coverage that you will have during that period, stage 2, you will be paying up to that $2,000. When you have paid out of pocket $2,000, you will then enter the catastrophic coverage when you will pay $0 for your medications. That's going to be huge for a lot of individuals. You will no longer pay that 5% coverage, what we paid prior to 2024. So we know that on the next slide, Medicare open enrollment has already started. It started on October the 15th, and it will end on December the 7th. Perhaps many of you have already made changes and decisions about what plan you'd like to have next year, and that's a wonderful thing. But let me tell you, if you change your mind between now and December 7th, you can still make changes. What Medicare will look at is the last change that you have made at 11:59 on December the 6th. And they will use December the 7th at midnight as the change that you've desired to make for next year. So if you still want to make a change, you learn something different between now and December 7th, you can do that. In our next slide, we will see who should enroll in a Medicare Part D plan, prescription drug plan. So if you currently have no prescription drug plan and you do not qualify for the low-income subsidy, you should think about, is this something that I should do? Remembering that Medicare is a voluntary program. You do not have to join, but also knowing that if you fail to join during your open enrollment period, that there may be a penalty for you. If your income this year is below $1,883 per month and you are single, or $2,555 a month and you are a couple, think about joining. Beneficiaries with other prescription coverage should check with their benefit manager before you make any changes. So if you have a retiree plan from your past employer and they provide a prescription benefit as part of your retiree plan, please do not make any changes without asking or seeking advice from your benefit manager. Because if you make a change because your next door neighbor tells you how great their plan is, and you think, oh, I'm just going to take their prescription coverage and keep my other benefits, you may lose all of your benefits. So check with your benefit manager. Also, if you are turning 65 before January 1st, you may want to consider making a decision about enrollment as well. I mentioned that there is going to be a late enrollment fee for a number of us. So the penalty for 2025 has increased by 6%. So the national base Medicare premium next year is $36.78. For Medicare Part D, your penalty is 1% of the $36.78 for each month that you have failed to enroll during your open enrollment period. So you don't want to miss that, or you will be subjected to a late enrollment period. And let's look. In 2025, if you never signed up for a prescription drug plan starting from 2006 when you were eligible to 2025 when you've decided to join, your penalty is going to be $984 per year. And that equates to about $82 per month. So you don't want to delay. There are some exceptions, and that exception will be if you have creditable coverage, if you are working past the age of your enrollment period, and your employer is providing a prescription drug plan that is creditable, and your employer will let you know during your annual notice of change whether or not your plan is creditable. If it is, you don't need to sign up right now and you will not be penalized. If you qualify for the extra help and you fail to sign up, your penalty will be waived when you decide to sign up. So please take note, this is a voluntary program, but the penalties can be harsh and they last for the rest of your Medicare life and will go up each year based on the national base premium amount. So you have received already some important letters, and I've highlighted a couple for individuals who may qualify for the extra help and or are receiving the extra help. But for all of us, we have already received our annual notice of change, and we'll take a closer look at what that is on the next slide or a couple of slides down. You may also have received an explanation of benefit. The explanation of benefit is not necessarily sent out to everyone. It used to be, but the last administration said to insurance companies that you don't have to mail that to everyone, but you have to make it available. So if someone calls to ask for it, you must send it to them. And you also must have it online so that everyone can see it. So you still have access to that explanation of benefits. What does it do? It gives you more detail about your plan, what the changes are going to be. It also talks about the cost of changes, which also is in the annual notice of change, but it also includes information about the pharmacies that are in your network, as well as a detailed list of the most popular medications that older adults take and what those medications are. What medications are on their formulary and what they look like in terms of some other categories that we will look at. All of us have also received a Medicare and You handbook. So your Medicare and You handbook actually will tell you almost everything that we are going to talk about today. It is a regional handbook, and at the end of that handbook, it includes all of your regional or your state standalone plans, as well as your Medicare Advantage plans. It doesn't give you as much detail as the annual notice of change, but it gives you some of the most important information that you can begin to look at before you may want to take a look at a more detailed look at plans that you want to compare. So please take a look at those things and note, if you receive anything from the federal, from the Center for Medicare and Medicaid, and I know we're getting a lot of junk mail now, but if you receive anything from the Centers for Medicare and Medicaid, then open it. It's important. If you receive anything from Social Security, open it because it is important. And if you receive anything from your current prescription drug plans or your current Medicare Advantage plan, open it because it is important. We're getting a lot of other mail from a lot of other insurance companies trying to ask to show you that my plan is better, consider joining ours. That you can pay attention to, or you can consider it as junk mail and not open it. But of those other three, please take a look at and open it if you get mail from them. So what we're going to see next is why would you consider switching? Because a lot of people think I'm happy with my plan. It doesn't cost as much now. I'm okay. I don't need to take a look at anything. But you're going to want to know if your prescription cost is going to increase to an amount that you're not going to be able to afford or want to pay. Also, if you've decided during your retirement, you're going to move to Florida or to Arizona or to another place to spend milder winters, you might want to consider a national plan that's going to work for you both in the state in which you reside and the state that you're going to go to for a winter break. If you're going to have, if you know you're going to have a complicated surgery next year, um, and you've been told about a doctor that really does well, that's an expert in this area. That doctor or that hospital is not in your network. Do you want to switch so that you are able to receive services from that physician and from that medical center? You may be thinking, I'm really healthy and I rarely see a doctor. I don't have any prescriptions, but I don't want to be penalized either. You might want to look at, are there going to be cheaper plans in my area? Do I want to join one of those plans because I don't have that? Of course, you're taking out your what is that globe that tells you what's going to happen in the future. But it's a chance you might want to consider an idea or switching that you might want to consider as you look at next year. If you've had a severe drop in your income and you no longer can afford the plan that you're in, or you may now qualify for the extra help, you're going to want to consider switching. Your former employer or your current employer is changing its current health benefits or your retiree benefits. They're no longer going to work for the plans that you have now. You may consider switching. We love our doctors. A lot of us are willing to follow our doctors to the ends of the earth. Your doctor's no longer going to be in the current plan that you have, but you want to keep your doctor. Is that a reason for you to consider switching? So there are a lot of reasons. That's why it's so important that you want to take a look at this. So what happens next? I mentioned that you already should have received your annual notice of change. So what does your annual notice of change say?
Samantha,
And if we want to go to the next slide now,
okay. Samantha,
so your annual notice of change.
Samantha, we do have one question that is very, I think you can answer it really simply, and it's relative to why consider switching. Jay Lee is asking us if he does want to switch, where can he do this? Can he do it on the Medicare website? And then we'll go to the next slide.
You can go to the Medicare website site, and we actually have a slide at the end of the presentation that gives you that address for Medicare.com, and the website that will help you to compare all of the plans that are going to be in your region. The other thing I tell individuals that you can do this, call your current prescription drug plan. Ask them the questions that you need to ask them. If I keep your plan next year, is my premium going to go up? If I keep your plan next year, and have all of your prescription drugs available. These are the current drugs that I take. How much are they going to cost me next year? What are the preferred pharmacies? A lot of people will overlook this because I have this year Aetna as my prescription drug plan. I can go to, we have a grocery store in Northeast Ohio called Giant Eagle. I can go there. I can go to CVS, and I can also use a pharmacy that we have called Drug Mart, or I can get mail order. If I go to either of those pharmacies, the cost of my medication, because they are preferred in-network pharmacy for Aetna or SilverScript, my cost is going to be lower for my medication. If I go to Walgreens for that exact same prescription, even though it's a generic, my cost is going to be much higher. People don't always realize that, but every plan has a preferred pharmacy, including your Medicare Advantage plans. So know that. Also know, and this is a tip, an outside tip, you do not need to use your prescription drug benefit if there is, say, GoodRx is going to charge you less for that prescription. Use GoodRx. Use whatever discount card you know of that is going to help you to pay a lower cost. It does nothing to put a negative mark on your prescription drug plan. You're getting that price cheaper. And now pharmacists can tell you, they aren't required. They can tell you if you can ask, if I use my GoodRx, is this prescription going to be cheaper? If I use one of the others that are out there now, is this going to be cheaper? They can give you that information now, and it's not hard for them to look that up. Prior to the last couple of years, they were not able to give that to you. It was illegal for them to give it to you. But also, let's move on your annual notice of change will tell you whether or not your premium is going to go up and down. This year, I paid $5.20 per month for my premium. Next year, that same plan is going to cost me over $40. Huge increase. So I'm not going to be in that plan next year. I've already made that decision. You need to look to see whether or not your premium is going to go up or down as well. Whether or not your deductible, that $590, is that going to go up? Did you have a deductible last year? Will it go up this year? Did they raise it last year from what your deductible was this year? Whether or not where your drug lies on the tier, and we will look at the tiered system, what you pay for a preferred generic, is that going to go up? What you pay for a preferred name brand, will that go up? We talked about whether or not drugs were deleted from the formulary. Was yours one of those? And will drugs be added? Again, the preferred pharmacy you're going to want to know, and whether or not you have transition coverage. If you need to switch to another plan, will your current prescription plan provide you with a transition prescription so that you will be able to get it? So here's the tiered system. All plans have a tiered system. Your lowest copayment is going to be the preferred generics. You will pay a higher cost if it is a non-preferred generic. You will pay a higher cost if it is a preferred name brand, and still a higher cost for a non-preferred name brand. Your highest copayment will be for specialty drugs, your unique drugs, or high cost prescription medications. So many plans will move around your prescriptions on that tier. So this year, your generic is preferred. Next year, it's not preferred. This year, your name brand was preferred. Next year, it may not be. Or it was not preferred this year, but next year it will be. So these are the things that you want to look at, and these are the kinds of things that your explanation of benefits will tell you. Also, you will be able to see that on the Medicare.gov website too, because they give you all of this information. So on one of the other things on our next slide, you will see prior authorizations, step therapies, and quantity limits. These are also important. Again, they are noted in that explanation of benefits. They are also noted on the website. Or if you call your plan, you can ask them about these things as well. But with a prior authorization, your doctor must request from your plan that they that they approve that authorization for you. And he must show medical necessity for the drug. If they don't approve it, they may say to him, we will look at a step therapy for this drug, where they will ask you to first take a lower cost drug in that same class to see if it works for you. If it doesn't work, your doctor may ask for an exception that they pay for the higher cost medication for you because you and your doctor have evidence that it doesn't work. They can approve the exception or they can disapprove the exception, but you must ask and get authorization for them to do that. Quantity limits. This is important because if your prescription drug companies say, we will pay for 31 tablets of your blood pressure medication per month, but your doctor notices that with a tablet a day, your blood pressure is not being stabilized to the point that he'd like or she'd like to see it. So they suggest take 1.5 tablets a day, or maybe take 2 tablets a day. But your plan said they will pay for 31 per month. So who pays for the additional half tablet or the additional tablet? You do. And you pay full cost for that extra tablet. But you want to look to make sure, and many of them do say that they will pay up to 60 tablets a month, or 62, or even 93 tablets per month. But you'll want to make sure that your prescription drug company that you choose or that you currently have will pay for multiple doses of your prescription pill each month. So on our next slide, we're going to first take a look at what's new with Part D. So we see that nationally, there's going to be a decrease in the number of plans by about 26%. Could be a good decision for a lot of us. Could not be a good decision if your plan was removed from the list for 2020. 5. CMS does predict that the average premium is going to go up 4%. Remember, mine went up way more than that, but the average for your standalone Part D prescription drugs is going to be an average of 4%. That means that 38% of us with a current prescription standalone plan will see an increase. And we're going to look at the prescriptions for the Medicare Advantage plans as well. But 115, so some of those plans, 157 are going to have options below $25 per month as a premium. That's a pretty substantial number if there are 185 plans. 115 will also qualify for 0 premium costs for people who qualify for the low-income subsidy. 79 of those 185 will have a 0 deductible. That looks good, but that doesn't necessarily mean that over the course of 12 months, you're going to pay less. And we'll talk a little bit more about that. And remember, the gap has been eliminated in 2025. So yes, that's a smiley face for all of us. So our next slide. I mentioned if you are snowbirds, there are a number of companies that provide a national option. So I've listed those companies. You may want to take a closer look at the number of at the plans that they are offering to determine which of those plans offer a national option for you. On our next slide, we're going to go to the Medicare Advantage plans and take a look at them. So this is new and this is great for Medicare Advantage plans for 2025. So next year, these plans must distribute to all of their members a mid-year enrollee notification of unused supplemental benefits for each year. One of the things that attracts Medicare beneficiaries to Medicare Advantage plans are the benefits. Remember, with Medicare Advantage plans, you still have all of the benefits that are afforded to you under Medicare. But in their contracts with CMS, Medicare Advantage or Medicare Part C plans offer additional benefits that are attractive to their members. The thing is, many members don't use these benefits, or they don't use half of them or most of them. So now they're going to have to notify you mid-year that these are your benefits. These are the ones that you haven't used. What do the benefits provide you? Is there any cost sharing with the benefits? So, for instance, many people will have dental benefits, which a lot of us hope that traditional Medicare will include as a standard benefit for all Medicare beneficiaries. But right now, many Part C plans have a dental benefit. They may say, we will provide you with $500 a year towards your dental costs. But if your dental cost that year is $6,000 and you don't have it, are you going to use the $500? Or they may say, we will provide you with $300 towards a pair of glasses. But if your glasses cost $600 and you can't afford it, will you use the benefit? So a lot of benefits go unused because even though they are a benefit, sometimes people cannot use them because of the cost sharing provision. So they will give you instructions on how to access that benefit and a telephone number that you can call and speak with someone if you need to, or if you have questions about your benefits. This is a really good new requirement for Medicare Advantage or Part C plans. So let's take, what do the Medicare Advantage plans look like nationally? What we see that there will also be a decrease in the number of plans by 3%. This is particularly important, I believe, to Medicare Advantage members because even though we have 5,218 different plan options next year, last year, that number was in the 6,000s. So that's a significant decrease. You'll want to know whether or not, and you should have already received a notice from your plan letting you know whether or not they have contract or will not contract with Medicare next year, and providing you with an option within their Part C plans to choose another Part C option. So, but 91% will have a prescription drug plan. So that leaves 9%, which is not a lot, but you want to make sure that your Part C plan is going to continue to have a prescription drug plan. If not, you then will have to choose one of the standalone prescription drug plans that I spoke about earlier. 62% of those plans will be an HMO. And it is among those HMOs that they will designate then a few of those HMO plans for individuals who have lower incomes. The average premium is going to be $17. About 83% of participants will have lower premiums. That's wonderful compared to 38% of those who have a standalone premium will see an increase. these plans are becoming very popular. Medicare enrollees are finding them to be attractive primarily because of the benefits being offered and the option of not having to pay a premium if you choose one of the HMOs, or what I like about Part C premiums, Part C plans, is that now we have some PPO plans, preferred provider organizations, that are having a zero premium for their beneficiaries. When we don't have to pay, that's always a better option for services that we receive for our health care. Also, last year, a give back premium. So features. So this was a new benefit. We're going to have more Medicare Part C plans offering a give back feature next year. Give back feature. They are going to give you back a portion of your Medicare Part B premium. So on the surface, you're thinking, yes, that's going to be great. But what I want you to do is not look at a single benefit, but look collectively, not only at the benefits, but the network, to make sure that it is going to work for you. Because you get a part of your Part B premium back doesn't necessarily mean that you're not going to have higher out-of-pocket cost with your Medicare Advantage plans. Even though we don't see a deductible, we have a co-insurance with Medicare Advantage plans, and we have a maximum out-of-pocket cost. You'll want to make sure that the other bells and whistles that they are putting in front of you is going to actually be a benefit and not just a lure into a plan that may actually, in the end, cost you more. On our next slide, we don't want to overlook, this is not new, as it is indicated there on your slide, but Medicare open enrollment always has, and Medicare Advantage, an open enrollment period from January 1 through March the 31st. This is where you have an opportunity. Your neighbor said, girl, you ought to check, or boy, you ought to switch to my Medicare Advantage plan. It was so great. I had lower costs. I had all these benefits. They were wonderful. You use that as your decision to switch. And then come January 1, they say, oh, your doctor says, we don't take this plan. And you're like, what? Or your hospital says, we're not part of this network. Or we don't use your suppliers. Then you're thinking, what should I do? This is your opportunity to switch. You can go back to the one that you had. You can go to another Medicare Advantage plan, or you can go back to Medicare fee-for-service, standalone, where you take your Medicare card, you have your prescription drug benefit, and you know how you're going to pay that 20% that Medicare fee-for-service doesn't generally pay for you, which takes, I think, greater consideration if that is going to be your option. But please note that this enrollment period is available next year. So the next slide, this is the low income subsidy for people who have lower incomes. And we saw the 22.5 was about $1,800. There's also a resource limit. Now, the resources and the income amounts are going to go up for 2025. We just don't have those numbers right now. Social Security puts out the resource limits and also determines what the income limits are going to be for the following year. And that's what the federal poverty limit that we'll see probably in the end of January, 1st of February. The resource limit should be out sometime in December. That's going to be important. And this is just a breakdown of that with the monthly amounts. Also noting that this amount for the resource includes $1,500 per person for funeral or burial expenses. So the next slide, changes for the special enrollments for people who are duly eligible, individuals who qualify for the extra help, or for chronic illnesses. So last year, you could only enroll or change plans. You had the option to change your plan one time quarterly. This was a change because prior to last year, you were able to do it every month. So it has gone back to every month. So if you need to change, your doctor is no longer in your plan no longer offers your medications, your hospital system is no longer in that plan, you can change to a new one every month, one that is going to meet your need. And so that's a good thing for those lower income individuals. On the next slide, we see how much you are going to have to pay for your prescription drug benefits. If you are institutionalized, your cost and your premiums, your cost is zero. If you are receiving home and community-based services, you will have zero premium. You will pay zero cost for your medication. If you are a community Medicaid beneficiary or your income is less than 150% of the federal poverty level, you will pay no more than $12.15 for any of your medications next year. And you can see in the parentheses there that the costs have gone up slightly for these two categories for 2025. And that's not unusual. It usually does go up by a little bit over each year. So on our next slide, here's the Medicare plan finder that we talked about. If you go to medicare.gov, now, let me preface this by hoping and asking that everyone that is participating today has a My Medicare, what do they call those? Plan? No, not a plan. Okay, I'm losing my thoughts now. But you can go on to My Medicare, an account. That's what I'm thinking. That everyone has a My Medicare account where you set up a username and a password. This is good because not only does it protect you from fraud and abuse, it also helps you to, when you go into your My Medicare account, you can see all of the medications that you took in a given year and what plan you are in. And Medicare then asks you, do you want to compare plans for 2025? It takes you directly to the site. Now, you can look without having a Medicare account, but you're going to have to enter all of your prescription drugs. You're going to have to enter your preferred pharmacy. You're going to have to enter your current plan. You're going to have to you're going to have to answer whether or not you are entitled to extra help. All of these things will be automatically loaded for you if you have a My Medicare account. If not, you have to load all of those, but we'll get the same options. So in our next slide, reminders. You need to compare your drugs. You need to look for the prior authorizations, the quantity limits, the step therapies. You need to compare annual costs. So if you are on that Medicare.gov site and you compare up to 3 plans at a time, perhaps yours and 2 others, you will see side by side which each of your drugs will cost at each of the preferred and non-preferred pharmacies that you may choose. and you will see whether or not there's a prior authorization, a quantity limit, a step therapy for your drugs. You will see what you will pay during phase 1, phase 2, and of course now during phase 3, we all will pay $0. And it will give you an annual cost. So whether or not that plan gives you a give back, if at the end of the year, are you paying less? Whether or not you have to pay a $590 deductible, at the end of the year, are you going to be paying more or less? So I like that for that reason. It takes out the assumptions and the dangling things in front of us that look good that we may choose because of that. So what happens after enrollment on our next slide? We'll see that you're going to get a notification that you have enrolled, an ID card, a plan summary, you're going to get a plan formulary, and you're going to get in the mail what are the preferred networks, pharmacy networks that you should choose. So finally, where do we go for help? So the Medicare.gov site is an excellent site. It's easy to navigate. It's easy to understand. Please go take a look. You can call Medicare, 1-800-Medicare, and ask for assistance. But I am going to put in a strong suggestion for OSHIP. OSHIP, this is the Ohio OSHIP. Every state has a SHIP. Go to your state SHIP office for information, the Senior Health Insurance Information Program, because they know about the insurance plans in your state. They know it very well. They do not get nearly as many calls as the 1-800-Medicare, and they will be able to help you to walk you through the different plan options. They're not going to make a decision for you, but they will say to you in the end, these are the 3 options that you might want to consider. And you will then have to make a decision. But I love the shifts. They are experts in what they do. This is their job. They are not hired temporarily because it is open enrollment for Medicare, and you can call them 12 months of the year. Call Social Security if you have questions, and the number is there. So I know this has been a lot of information. We're going to stop sharing at this point. I'm going to ask Robin if there are any questions in the Q&A that Xavier and I now might be able to answer for you. Robin?
Hi, Samantha. I think Robin might be coming off of mute.
Okay.
We do have a couple of questions. We actually have quite a few questions for you and Xavier. One of the questions is really about traveling out of the country. Susan Day would like to know if she travels out of the country some, can she add coverage for traditional or Medicare Advantage plans?
So Xavier,
Yeah.
do you?
Like, so Medicare does not cover out of the country travel. So if you are going out of the country, you would need to get travel insurance for that. The only caveat to that is if you're driving to Alaska and while you're in Canada, you would get could have some coverage there just because there's no way to get to Alaska without going to Canada. But that's the only way. Otherwise, you would need travel insurance.
Yeah, but also, Xavier, there are a few plans, and I don't know which ones that may offer some emergency benefits out of the country, but they are not going to cover your healthcare costs or even most of it, but that's something that you might want to ask your individual or look to see if your individual Medicare Advantage plan may have something like that as a benefit.
Okay, our next question is around using the Medicare.gov. So if you are in your account on Medicare.gov and you put in your zip code, are you limited to only the Part D plans shown on the website for your zip code?
Yes, that is what they're going to show you. If you are looking again for a national plan, you might want to put in one of, compare the national plans to your current plan and know that the national plan, and it's going to tell you whether or not it is a national plan and how you can use that. I would also encourage you to call that individual insurer to ask specific questions about your needs and their national plan options. Remember, this is for Medicare Advantage because if you have a Medicare fee-for-service, Medicare is a national plan. So if you get sick anywhere in the United States, you will be able to use your Medicare fee-for-service if that is what you use, and you have a supplement. Your supplement generally covers what Medicare will cover anywhere in the nation. It is your prescription drug option that you want to get answers for and choose perhaps a national plan.
So we only have 1 minute left. If you haven't had a chance to answer your question or we've not gotten to your question, we'll follow up with you after the program, but we do have 1 minute left in our webinar.
Okay.
The next question is, I've been on a Medicare Advantage plan, but there are less benefits offered through mine for 2025. They want to know if they can switch to traditional with the supplement and continue on current weight loss program I am currently covered for.
Ooh, that's a difficult question. And when I said earlier that you really want to do your homework, because if you've had a Medicare Advantage plan, you are outside of your initial enrollment for a supplement, which means, yes, you can join one, but they are now going to underwrite your coverage, which means they are going to look at your age, they're going to look at your health status and determine whether or not they will accept you as a member and what your costs will be. But those are things you want to look at up front before making that switch.
Right. Okay. And we are at the end of our program. I do want to let everyone know, first of all, thank you for joining us. We hope you found this helpful. We do have an AARP Ohio YouTube. We will have a shorter version of this posted for you to be able to watch. And if you send an email to the AARP Ohio inbox, you would be able to ask additional questions, or you can even post them on that YouTube and we'll be monitoring them and try to answer back to you.
Okay. And Michelle, before we go, I want to apologize for my ineptness at being able to share my screen correctly. I did practice and it worked.
Yeah, we did. We had a great practice. I don't know. I couldn't do it either, Samantha. I had to do a little
Well, that's good.
Switcheroo, yeah. So thank you so much for your time and all of your expertise you shared with us so that we can help people get this information. It's wonderful, wonderful information. And thank you, Xavier, for joining us. And thank you all and have a great day. This concludes our program.
Bye-bye.
Thank
Bye-bye.
you.